To item 3 on the adjournment debate by Deputy Gerald Nash, the need to improve ambulance services in the Drogheda area. The Deputy has 5 minutes.
Thank you very much, Chairman. Could I just say at the outset that I'm disappointed that the Minister for Health is not available to respond to the debate here this evening. And I'm disappointed also that none of the Ministers of State at the Department of Health appear to be available either. Notwithstanding that, I'm sure that the Ministers who are here this evening to respond will do so to the best of their ability. I just want to put on the record the fact that that's unacceptable to me, to be quite frank, that Ministers from the Department of Health are not here to address this very important issue. If any one of us here this evening thinks that the health service is working, I would challenge all of us to think again. The public health service isn't working if it allows a man fighting for his life on a busy street to wait 30 minutes for an ambulance. That man was Peter Sherlock, and he died in hospital soon after being taken there in the back of a van by a good Samaritan who was passing by at the time and saw the man in distress. He was taken in the back of a van because there was no ambulance available to take him to hospital. We're not talking here about a street in a small provincial town 50 miles from the nearest acute hospital. We're talking about a tragic incident which occurred in the streets of Drogheda, the largest town in Ireland. A tragedy that occurred less than 1 mile from Our Lady of Lourdes Hospital, and only a matter of a couple of hundred metres from the local ambulance base. We've been told over the past few days in a series of HSE statements that all vehicles stationed in Drogheda at the time the call was received at 9:59 hours on the 26th of May were, I quote, tasked on calls at that time. We're told that the closest available ambulance was dispatched to the scene. Why is it then that the closest available ambulance was located at Navan, 30 minutes from Drogheda town centre, the healthcare centre of the entire North Eastern region? We are told that the 3 ambulances that were at Our Lady of Lourdes Hospital were all actively engaged with patients. We were also informed, and only thanks to the tenacity of the team at the Michael Reid Show and LMFM, that other ambulances were involved in patient transportation at the time the call was received. I want to put a quote on the record, Chairman. Ambulance services resources are deployed on a clinical basis to ensure that the appropriate patient gets the appropriate response. That's what the HSE said in a statement last week. The Ministers present, I wonder would you all agree that the late Peter Sherlock got, I quote, the appropriate response? Because I don't. This whole tragic saga has led to a very real fear in terms of the ability of the ambulance service to respond to emergencies in Ireland's largest town. You will agree that it's imperative that the general public has to have confidence in the ambulance service and in the health service in general. And this tragic episode, quite frankly, has challenged that confidence. The internationally accepted emergency response time is 8 minutes, whereas it takes approximately 30 minutes for an ambulance to travel from Navan to Drogheda. The circumstances around Mr Sherlock's death have sent shockwaves around the wider community in Drogheda and the Loud Meath area in general. 1 person too many has died waiting for an ambulance in Drogheda. I want to ask the Minister present, representing the Minister for Health, if he can say with confidence to the people of Drogheda that this will not happen again. I want to ask him too if he has confidence that the HSE ambulance service has the necessary resources placed at its disposal to do the job the public ask of it. I want to implore the Minister to take definitive action to address the failures exposed in this case, to take a different course and to dispense with the impenetrable HSE speak and confront this as the human tragedy it was. And I want the Minister present and I want the Government to be able to look me in the eye and look the people of Drogheda and the people of Louth in the eye and tell them and tell me that this will not be allowed to happen again in Drogheda or indeed anywhere else in this country for that matter.
Thank you, Deputy. Minister.
Dear Cahill, first of all, on behalf of the Minister, I wish to thank Deputy Nash for raising this tragic occurrence on the adjournment of the Dáil this evening. And for Minister Riley and I wish to offer our sincere condolences to the relatives of the person who has died. From what Minister Riley has been informed, he understands that the man concerned had collapsed in the street and passers-by came to his help and called for an ambulance. It appears that it was subsequently decided at the scene, because of the man's condition, to take him direct to hospital by car, and the ambulance was cancelled. The HSE's log of calls to the National Ambulance Service does bear out this version of events, as the ambulance was cancelled 9 minutes after the first 999 call had been received. Minister Riley commends the instincts that prompted people in the street to help a fellow human being in dire situation. No one can predict the outcome when faced with such a dilemma. The emergency services can provide advice and support over the phone while an ambulance is awaited. but the confusion on the ground may have made this difficult in this case. This case underlies the need for the reform and modernisation of the ambulance service currently underway. While it does not appear to have been an issue in this case, the move to 2 national call centres to prioritise and manage calls is clearly essential. It is critical that emergency ambulances are used for emergency services and that there is a rapid handover of patients at emergency departments. Supported by the Department of Health and by HICWA, the National Ambulance Service is working to improve the management and integration of its services. This includes a reduction to 2 ambulance control centres nationally with appropriate technology, a clinical lead for pre-hospital care, development and implementation of new performance indicators for pre-hospital care, and development of standard national criteria in relation to non-emergency patient transport. The HICWA report, Pre-Hospital Emergency Care, Key Performance Indicators for Emergency Response Times, published in January 2011, recommends response times for first responders and for ambulances. The HICWA response time standard for transporting ambulance is 18 minutes 59 seconds for life-threatening emergencies in 75% of cases. The HSE has been recording this data since January 2011 and since March 2011 has advised that it meets the standard throughout Ireland. The National Ambulance Service has undergone significant changes in order to ensure quality, safety and value for money. In line with other clinical areas, this process is ongoing as clinical needs and standards develop. I and Minister Riley believe that these developments are in the best interest of patients and that they are a key part of the government's work to ensure high-quality emergency care. Again, I finish by once more offering my condolences and that of the Minister to the relatives in this case.